Welcome to our new series of What's Your Focus. As you know, in What's Your Focus, we showcased our guest editors who guest edited specific issues for European Urology Focus. And today I'm particularly happy to present my friend Kari Tikkinen from Finland. Kari is a world-renowned expert on evidence-based medicine. He's done extensive research at McMaster in Canada, Dr. Gordon Guyatt, one of the most cited researchers in the field in the world. So welcome, Kari.
Thank you very much, Christian.
Kari, you had issued evidence-based medicine not too long ago in What's Your Focus already. So tell us about your motivation to do another series on that topic.
So first of all, thanks so much for you and the European Urology Focus for these opportunities. And it was a little bit more than 2 years ago, in the very late 21, when we published the first series, and that was covering surrogate endpoints. There was subgroup analysis, heterogeneity. There was many aspects on evidence-based medicine with urologic examples.
Right.
But obviously, in one series, you can't cover the whole evidence-based medicine principles. And then, again, thanks to Focus and you, we got the opportunity. We're very happy to get the opportunity to have the second series and then continue with maybe a little bit more advanced, not yet too nerdy, but like non-inferiority trials, platform trials, values and preferences, and things like that. And again, like using urologic examples.
One of the most debated publications was on platform trials. Everybody talks about the Stampede trial. We've known that we've learned so much from this trial. Are there actually any downsides? I mean, it looks like that would be the perfect setup of a clinical trial, the way it goes, and to continually following up those patients. But maybe there is something that we need to know more about.
I mean, obviously Stampede and its leadership and all the whole contributors have done an amazing job. Like in the series, in the Focus, there's the Noel Clark and Nick James, one of the pioneers. They wrote about Stampede. They wrote about platform trials.
Right.
Platform trials, I mean, I think they are great.
Right.
Maybe the biggest disadvantage with them is that they are not easy to do.
Right.
You need to be skillful. You need to have resources. You need to have a critical mass of people who can do it. If you can do them, they are amazing. Of course, any research has always some limitation, but they are one of the best ways. I think we would love to see more platform trials in urology and beyond.
So impressive achievement of our UK friends, again, who really do clinical trials really well. Kari, one of your most remarkable publications is on values and preferences. We've been in the MELAT's guideline panel of the EU. You've written about that. Can you tell our audience a little more about values and preferences? Shared decision making is a topic that is coming up also at this meeting here in Paris. Tell us more about it.
I mean, critics of evidence-based medicine always say that it's a cookbook medicine,
right,
and it's just numbers, and you don't take into account the values and people, and that's not really true. Evidence-based medicine has 3 principles.
Okay.
First of all, you have to use the totality of the evidence. You can't just cherry pick. Second of all, you have a hierarchy of evidence. For certain questions, certain types of research is better than others. For treatment effect, for instance, randomized trials. But evidence it's never enough alone. We always need people's values and preferences, patients' values and preferences. And that has been a neglected area,
right,
both in research and clinical practice, I would say. And evidence-based medicine is now taking it more seriously. We have mentioned it a long time, but we haven't done maybe so good job. It's very important if you want to practice modern medicine where no decision about me without me principle, that the patients can and should affect the decision making.
Okay.
So then you need to take into account the values and preferences. How to do it? You have to do it in office, ask the patient, but then also guidelines and research should know the average values and preferences, because it will help us to create guidelines when we know that what typical patient thinks.
Okay.
So in that paper, we show both a qualitative research style and a quantitative research style. Jessica Wheeler and Sachin Malde did a very good job, and they cover these aspects and how to take values and preferences better into account in clinical practice and in research.
Fantastic. Well, if you're interested more in that topic, please go to our website and look at the special issue guided by Professor Kari Tikkinen. But you can also go here on our website of the annual meeting of the EAU here in Paris. Kari was guiding a very nice plenary session on EBM. So if you want to know more and learn more, there's ample evidence broadcasted by EAU and European Urology Focus. Kari, I would think this is it. Greetings from Paris, from the annual meeting, and we all hope to see you again very soon. Thank you very much.
Thank you very much, Christian, and European Urology Focus.
Thank you.